You're muted, LaVeta.
I'm sorry. I had such a nice feel. I was going right along.
I'm
Let me
sorry.
start over. I am LaVeta Wetherington. I am the co-chair, along with Ren Bryant, of the Quality of Life Committee for the North Carolina Retired School Personnel. And one of our major responsibilities is planning and facilitating the Wednesday workshops that are held each month for our members in the retired school personnel on topics that relate to your quality of life. The focus for last month, this month, and next month are all looking in terms of the open enrollment period that's coming up with our state health plan and helping you to be as educated as you can be about the options that you will have available. So for today, we have Maria Ramos, who's the call center manager for Pierce Insurance Group, who will talk to you about our supplemental benefits that are available and that you have to enroll and sign up for. Some of you may already be enrolled in some of those programs, as I am, but you can always benefit by learning a little bit of those little tidbits about what your coverage actually covers. So with no further ado, I'm going to turn it over to Maria.
Thank you, Lavita. Good afternoon, everyone, and welcome. Thank you so much for having us today. I am actually joining you. My name is Maria, of course. I'm the call center manager at Pierce Insurance, and I'm joining you along with my colleague Shanita Weinstock, who's in our billing department at Pierce. And so it is our privilege to offer you exclusive supplemental plan benefits that are available only to North Carolina state retirees through the retirement system. And in this presentation, we are going to review the details of the 2026 plan year benefits, which are going to include, as Lavita stated, some of you may already be enrolled, so you may be familiar. It is United Healthcare Dental, United Healthcare Vision Spectera, and Norton LifeLock Identity Theft Protection. So with the dental and vision plan, along with the identity theft protection, they're designed to complement your retirement benefits. And sorry, whether you're deciding to, we want to help you understand how these benefits can work for you. So sorry, I'm having a little bit of connection issue. Is it still showing you the presentation?
Yes.
Okay, sorry. So in that case, our goal today is to help you understand how these benefits can work for you, whether you're deciding if the dental, vision, or the identity theft makes sense for you, or you just want to, if you're already enrolled and want to maximize your benefits. So we'll go ahead and get started with that. So if you are retiring soon, once you're officially retired, you'll receive a brochure from the North Carolina Treasurer's Office in the mail. And this gives you a chance to review your benefit options on what you could sign up for. And there is a 60-day window for you to enroll so that you could get the earliest effective date possible after you get that first retirement check. There are 3 ways for you to sign up. You can call our office at 855-627-3847. You can complete the application that is included in the brochure, or you could self-enroll online on ncretiree.com. There is a brochure, application you can also download from the website too. And you could email, fax, or mail that in to us. So now, who is eligible? Of course, North Carolina retirement benefit recipients are eligible. Those of you who may be on long-term disability retirement, you could also sign up. You can include unmarried dependents, so a child that's up to the age of 26. Unless they're handicapped or disabled, then they can remain enrolled past that age of 26. And also surviving spouses can enroll. If you're a surviving spouse, you're eligible and you just enroll through the same enrollment process as a retiree would. Okay, so in case you've not retired yet, this is the enrollment brochure that you receive when you officially retire. So it'll say enroll within 60 days and it'll have supplemental benefits with our name and number on there, along with the coverages that you could sign up for. So this is the one for this year so far. If you're an existing retiree, of course, that has been sent when you had retired. So you can access a copy of the brochure at any time on the website ncretiree.com also. You could view or download a copy of that. All right, so let's dive into the dental plan. So again, that's through United Healthcare. Diagnostic and preventive services get covered up to 100%, which would include services like cleanings. You do get 2 cleanings per calendar year, exam and x-rays. And they're covered up to the UCR, which is the usual, customary, and reasonable charges based upon your area. So basically, like the average cost that in-network providers charge in that area is what United Healthcare covers for that service. For basic, restorative, and major services, those get covered up to 50% of that UCR, which would include fillings, extractions, root canals, dentures, partials. Those would all be covered up to 50%. All right. So there is a calendar year maximum benefit of $1,000, which means that you receive $1,000 in benefit to use for any services that you may need. And there's no waiting period. So as of your effective date, you are able to begin using the plan. So I'll give you an example. If you were to enroll right now in the month of August and you'll pay for it in September, your effective date is October 1st. So as of October 1st, you can begin using the insurance and file claims on any service that you may need. You can visit any dentist of your choice. Of course, you would save more by going to one of the preferred providers that are in network. There is a deductible of $25 that applies to those basic and major services covered up to 50%. If you're just getting your cleaning or an exam for the diagnostic portion, there's no deductible for those. All right, so included with your dental plan is an awards program called the Consumer Max Multiplier. It is something that is automatic. You don't have to sign up for it, nor do you have to pay for it. It's already part of your plan. And the way it works is that if you go to the dentist at least once during the calendar year and your total paid out claims for that year are less than 500, United Healthcare will award you $250 to use. It'll be kind of like a savings that's reserved for later use, and they'll add that to the following year. So you'll have your $1,000 coverage, and you'll earn the award if you meet the criteria, and then you'll have that 250, and you can keep earning that 250 until you reach an award maximum of $1,250. So when you take that award plus your calendar year maximum of 1,000, you could potentially have 2,250 in benefit money to use for your claims. Typically, you have to use your $1,000 benefit first, and then they'll pull out of your reserve money to cover any remaining claim portion. And each member does earn this. So if you're enrolled yourself and a spouse possibly, or like even a child, each one of you will receive or be able to earn that award. All right, so the premium. So currently the retiree only premium is $38.07 monthly. Retiree plus one dependent, so that could be a spouse or a child, $90.14. And retiree plus family is $126.38 monthly. There is the hearing aid discount program is included, which again, that's at no additional cost to you. It's completely free. All right, so that summarizes the dental. So let's talk about the vision plan now. There is no waiting period for the vision plan either. And you do want to go to an in-network provider to save the most money on those services. And the hearing aid discount program is also included at no additional cost to you. You have 2 copays that are included in the plan. There is a $10 copay when you go get your routine eye exam, and a $10 copay when you purchase the materials. And materials are going to be the lenses, the lens options, and your frames. It's just one copay for all of that of $10. So what you receive with the vision plan by going to an in-network provider, your comprehensive eye exam or the routine eye exam gets covered in full after that copay. Your standard lenses are also covered in full after your $10 material copay. You get an allowance for the frames of up to $130. So if you were to purchase a pair that's like $180, $130 would be covered towards that, and then you would just pay the difference of that $50 for the remainder of the cost. And then you can get contact lenses, which are covered up to $125, or you can get up to 4 disposable boxes. It all just depends on your prescription. After that copay, you just can't do contact lenses and the glasses. You would have to do one or the other. Now, some of the lens options that you would receive that are covered in full after that material copay is going to be standard scratch coating, UV protective lenses, the standard and deluxe progressives, and polycarbonate lenses. And I believe the progressives is going to be considered that no line on the lens. All right, so for the premiums, so there are 2 vision plans. Plan 1 is going to cover your routine eye exam and the materials, which we've discussed was the glasses and your lens options. It is $6.81 for retiree only. Retiree plus 1 dependent, $13.79, and family coverage is $15.49. Plan 2 materials only. So the only difference between the two is that Plan 2 does not cover the eye exam portion. And you may wonder, well, why wouldn't you want to do the exam portion? So there are instances where some people may have a medical reason for their eyes to be examined, such as glaucoma or macular degeneration. And so that eye exam is usually considered medical and it gets filed to the health insurance. So you may not benefit from, it's not a huge difference in the price as far as the plan 1 or plan 2, but of course it'll save you a little bit. And if it can't get filed by this vision plan, then you could just opt out and go with the material only portion. If you, for instance, received a exam that was considered medical, but also went and possibly got a second eye exam throughout the year and just for routine, then in that case, you could possibly go with plan 1, but plan 2 is always an option too. So that one is $4.74 for just yourself, $9.62 for retiring 1 dependent, and for family, $10.75. All right, so we've mentioned the hearing aid discount quite a bit. So just to do a quick overview of that, again, it's a program. It's not a plan that you have to call and sign up to get it. It is part of the plan for dental and vision. So as long as you're enrolled into either one of those, which that means you don't have to have both. As long as you have dental or if you have vision, you are able to take advantage of the hearing aid discount program. And again, no additional cost, but you can save up to 50% off those hearing aids per ear when if you were to be interested. You do have a promotional code that you have to provide by calling 1-866-926-6632 or by visiting the website uhchearing.com/employee. So when you call that number, you would provide them with that promo code so that they know you're part of the retirement group. Then from there, you have to be enrolled. So of course, you're going to have a member ID for your dental or your vision plan. And you'll give that to the representative or provide that on the website so they can confirm that you're actually enrolled. And then you can proceed with the whole process of setting up an appointment and possibly finding a provider and looking into the different brands of hearing aids that they offer. All right, so I know that we've been covering a lot of material, so if you think of any questions, drop them for us in the Q&A or in the chat in Zoom, and we'll answer those for you towards the end of the presentation. And so now LifeLock. Why is this important for retirees? Well, this is something that's an ongoing concern for a lot of us. So we've gathered a few statistics to share with you. So in 2021, 23.9 million Americans became victims of identity fraud. More than 1 in 4 adults or older adults age 55 and over have experienced identity theft, and there's always a new victim of identity theft every 2 seconds. So that is something to, be concerned about. So the way LifeLock is going to assist is that they monitor your private information, which is going to include your social security number, your credit cards, bank accounts, 401k and investment accounts, the title to your home, and any address changes that you do at the postal service. There is also a secure VPN, so it helps to keep your browsing secure and private so that you're not a victim. There is a $1 million protection package that is included with the Norton LifeLock plan. They will provide $1 million to help with stolen funds, $1 million towards personal expenses. So in case you have to do any lodging, travel, they'll help reimburse up to $1 million. If you do get compromised and have to get any lawyers or experts, they also provide $1 million reimbursement for that as well for those expenses. All right. So one of the features of the identity theft protection plan is the stolen wallet protection. Norton LifeLock is going to assist you in canceling and replacing your credit card, social security card, driver's license, and more. If you were to lose it or get stolen, they'll monitor while you're browsing to make sure your information doesn't end up on the dark web. And there is a Norton password manager that's included where you can create one main password and then it'll keep everything else stored for you. They'll even create passwords for you so that you don't have to memorize everything. And there is smart firewalls, secure VPN, cloud backup that is included with that as well. And of course, there's a lot more features with the identity theft protection plan that you can take advantage of. And it's offered to state retirees at a much lower rate than if you purchased it going directly to LifeLock. There isn't a retiree plus one category. It's just retiree only would be $8 monthly. And if you enroll yourself in one or more dependent, that's considered family for them. So that would be $14 monthly. Okay, so if you were wondering when can you enroll or make any changes, for anyone who is already retired, so you're existing, it's been months, years, whatever the case may be, there is an annual open enrollment held, which is actually approaching next month. It'll begin September 15th through October 30th, 2026. For those of you who sign up during that time frame, your coverage becomes effective January 1st, 2027. And if you're already enrolled, though, you'll still receive, so everyone that's a North Carolina State retiree is going to receive an enrollment booklet. So that way you know that it's time to make any changes, enroll for the first time, or maybe add coverage that you didn't already have, add dependents. You can also cancel. But if you're already enrolled at this time and when open enrollment approaches, you'll receive the booklet. If you don't wish to make any changes, so if there is any change to the premium or the coverage, or if anything's added and you're fine with what you currently have, you do not have to re-enroll. So that is a good thing that you don't have to worry about applying again. It'll automatically continue for you for the following year. So if you're enrolled in dental and vision at this time and that's all you want to keep, you don't have to re-enroll. You'll still be enrolled in dental and vision for 2027. But now if you're a new retiree or going to be retiring soon, you won't be eligible until you receive that first retirement check from the retirement system, and which usually comes in the mail. Once you receive that, you can then sign up. So open enrollment wouldn't apply to you. So let's say, for instance, you aren't retiring until October 1st, which is in the middle of open enrollment. You are a new retiree, so you get that window of enrolling, so you could still sign up past that open enrollment time frame, and there's no penalty.
Maria,
Yes, ma'am.
someone has a question. Enrolled in Advantage, are they allowed to participate in these also?
Yes, as long as there's no as long as Medicare Advantage doesn't tell them that they cannot do it, they are more than welcome to enroll because it is a separate account where they pay for this separately. And most of the time you would be signing up for these benefits in case your medical plan doesn't include dental or vision coverage, or maybe if it does, it might be something very limited. So yes, you can most definitely sign up for them if as long as they do not say that you can't on their side.
And how do they know if they have plan 1 or 2 for vision?
So we can take a look for them. They can always call our office and we can check. Of course, the premium, it would tell you the cheaper one is the plan 2, but they can contact our office and we can check to see which vision plan they're in. Because the card itself, it doesn't specify what plan, like if it's Vision 1 or Vision 2, it just has the member ID. And so the claims department would be able to see which plan they have. And of course, we can verify as well.
And what's that number?
Our number is 855 627 3847. And we'll post that in the chat too, so that everyone can have it.
Someone wants to know, can they enroll in LifeLock if they're already a member?
Yes, they can go ahead and enroll. They would need to cancel their current plan because it intervenes with the one through the retirement system. So as long as that one gets canceled, they'll be able to sign up for this one. It would need to be canceled by the time that this one becomes effective. But yes, you most certainly can. And typically, if someone were to already have the identity theft protection plan directly through LifeLock and they sign up with us, it kind of triggers or flags the account, and we get notified if their account can't be completed. And so they will get reached out by our LifeLock account manager in office to let them know that they need to, if of course ask them if they know if they may have another plan and so that they know whether they wish to cancel that one so that they can proceed with this one or if they just decide to keep the other one. And you could sign up for this one at any time, the identity theft. There's no deadline. And it looks like Cassandra, if you're already receiving these funds, will I have to re-enroll again? Or does it just roll over? So no, you don't have to re-enroll. It will continue for you. Oh, I apologize. When you say funds, are you referring to the Consumer Max Multiplier on the dental plan? Okay, we'll go back to that question in a moment. And I see someone wanted to know the cost for the LifeLock. It's $8 for retiree only, and for family, it's $14 monthly.
If I'm already retired and I want to get the LifeLock, do I need to wait for the open enrollment period?
You don't. So we have an full all year round enrollment because there's people retiring throughout the year. So we're already doing applications for first timers, but we are pretty lenient with that and we do allow members to enroll outside of open enrollment. Your effective date will just be based upon when you enroll. It is a 2-month enrollment process. So if you decide to possibly do it this month, your LifeLock coverage would start October 1st. And then you would just pay for it the month prior by either having it taken out of your retirement check monthly, or you can choose to be bank drafted. LifeLock currently does not send out bills for the premium. It either has to be drafted from a bank account or taken out of the retirement check. Okay. All right, so I'm just gonna go on to the presentation real quickly. So we did want to show you that this is the brochure that you will be receiving. So if you're already retired, this is the preview of what the enrollment booklet will look like that you'll receive. And it is anticipated to be delivered by September 14th. So it should be coming in the mail for you in the next month or so. Once it's available, it will also be posted on the website. So you can always take a look on there as well. And one thing I wanted to point out on this brochure, so right now we've been speaking about the dental, the vision, and the identity theft. So for 2027, there is actually a new product that's going to be launched that the retirement system approved. It's going to be a whole life insurance. And that one, we actually don't handle that myself or Shanita. We're not in that department, so I can't really give you too much information on that. But there will be webinars that you can join for open enrollment, which will describe and give you all the information you may need on that whole life insurance, as well as the dental vision identity theft for the upcoming year. And Shanita, if you could show that for us so we can present the. All right. Okay. So the upcoming sessions for open enrollment are going to be held. As far as I know, these are the set dates. If anything were to change, I can make sure to let you know. But for right now, there's going to be sessions held on Monday, September 22nd, on September 24th, September 30th, October 6th, and October 8th at distinct times. There's going to be two separate ones, one for the dental and vision and identity theft, and then there's going to be one specifically just for the whole life with long-term care benefit that you can sign up for starting for 2027. All right. So if at any point you guys have any questions, you're more than welcome to contact our office at 855-627-3847. You can also view our website online at www.ncretiree.com to look over the brochure, get access to your dental and vision account or the identity theft, and you can also view or download that brochure. So there is a chat option on ncretiree.com that you can also, it is live. So you can click on that if you ever are on the website and have questions or just need some guidance. You can go to that and it's going to ask you to put your name and your email address. Someone will join in because it is live. It is also only available Monday through Friday from 8 a.m. to 5 p.m. And of course, someone from within our office will be responding to you. The other option is you could send any questions you may have or requests to our company email, which is info@pierceins.com. And that is also responded during business hours from Monday through Friday, 8 a.m. to 5 p.m. So at this time, I think we could answer some questions for you guys. So if you have anything you'd like to ask, definitely let us know. If you wanted to know open enrollment, again, that date is going to be September 15th through October 30th, 2026.
Maria, there are a couple people who have requested to review the dental program again, if you don't mind reviewing that since we have time.
Yeah, absolutely. Give me 1 second. So, all right. Would you like for me to go through some of these questions first or do the presentation on the dental?
I think that that's the last of the questions. Was the last two were asking to review or explain the dental again. I've been trying to kind of keep up with them, and Carol's asked most of them.
Okay. And I do have, Shanita has also responded to a few for us as well. So let's see. Okay, I see that, Rosalind.
Mm-hmm.
Okay. All right. So give me one moment. Shanita, can I have you to set the dental portion again? Okay. So with the United Healthcare dental plan, you get diagnostic and preventive services covered up to 100% of the UCR, which is the usual, customary, and reasonable charges. And that's going to include services like exam, x-rays, and 2 cleanings per calendar year. So there is no deductible that applies to those services. And I apologize. Okay, here we go. Basic restorative our services are covered up to 50% of that UCR, which is the usual, customary, and reasonable charges. That's the average cost that dental providers charge in your specific geographic region. Those are covered up to 50% along with major services. Those are also covered up to 50%. And that's going to include services like your fillings, you've got extractions, root canals, dentures and partials, and bridges. Those would all be covered up to 50%. And it is going to have a once per year $25 deductible. May I have the next slide? All right, so it's $1,000 calendar year maximum. That means that you receive $1,000 to use towards all of your dental services. There's no waiting period. So that means that you don't have to, so typically the time it takes to enroll is about a 2-month enrollment process. And, so you are waiting for it to become effective. So sometimes you may think that is the waiting period. The waiting period is actually going to be when you sign up and it becomes effective. You have to possibly wait several months before the insurance will actually cover a service for you. So there are some plans where they'll say, okay, if you have to have an extraction, you have to wait 6 months, maybe even 12 months. Of course, it could vary before the insurance will actually cover that service. So with this plan, that's not the case as of your effective date. So if you're going to start August or start August 1st or September 1st, whichever date that you were given when you sign up, you can use it for any service and you don't have to wait any specific amount of months before they'll actually cover that type of service. So no waiting period for that. You can visit any dentist of your choice, but you do save by going to an in-network provider, because if they're not contracted, that means that they're probably going to charge a bit more than what an in-network provider will charge you. So you're left with more out-of-pocket costs because, of course, that service is costing you more in general. So it's definitely more beneficial to use someone that is in network. The deductible only applies if you're getting the basic restorative and major services. So again, that's going to be fillings, extractions, root canals, extractions. If you have to have an extraction and have like anesthesia, that all falls under that too. Maybe a deep cleaning, there is that $25 deductible. So if you go get a extraction and you have to go back and get a filling, that's one of the 50% service. You've already met that deductible with that prior service, so you don't have to pay that deductible again. It's just one time, and that is per member. So if your spouse, for instance, was enrolled too, and all they get is a cleaning during that year, then there's no deductible that applies for him because he didn't receive a basic or major service. So your diagnostic and preventive have no deductible, just the other ones covered up to 50%. All right. The Consumer Max Multiplier. So it's an awards program that United Healthcare Dental has as part of the plan, as part of the contract. So you're not paying for it, and you're automatically are eligible to earn award money through this Consumer Max Multiplier. And the way it works is your total paid claims must be less than 500 during the year. So right now, if you were to be enrolled in 2026 and you went and got services, they have to be under $500. If you do that and you went at least once, so you can't just not use the plan, because of course that would make you under 500, but you have to go at least once. And then if they total up to be less than 500, United Healthcare Dental is going to award you $250 to have in a savings, it's reserved, and it's going to be added to your account. So it'll show up when you speak to the claims. It'll show that you've earned $250. So you can keep earning that as long as you go at least once to the dentist and your total paid claims are less than 500 every year. You keep earning it as long as you qualify up until you reach $1,250. If you were to reach that $1,250 of award money, you won't be able to earn it anymore because you've maxed it out at the amount that you could potentially earn. So when you add the award money of $1,250 plus the $1,000 calendar year maximum that you are receiving by the plan, you could potentially have in total $2,250 to use towards your claims that fall, the following year. So it's something nice that you don't have to do anything, of course, as long as you meet the criteria. Next slide, please. All right, so each family member is eligible to earn this. Anyone who's enrolled under the dental plan can earn this. And this is where it mentions about possibly having 2,250. So let's say 1 year you had services and they were over $500 and you've currently accumulated 250. That means that following year you went over that amount, the limit, so you won't be earning that 250 for that next year, but you'll already have 250 from the prior year. So whatever you earn, it never you never lose it. It rolls over every year. You'll still start with $1,000 every year, and then if you earn anything through the awards, you'll keep that, and it'll keep rolling over until you actually have to use it. And the one reason you would need to use your award money is if you use up your $1,000 maximum during 1 year. So if you were to do that, they'll pull from your award money. And in the example earlier, if you at some point after several years max it out and earn the 1,250, you'll stop earning it, of course. But if you had to pull from it, once you start depleting that award money, you could then start earning it again as long as you meet that criteria. Does anyone have any questions on the Consumer Max Multiplier?
I've had an experience with that, if you don't mind me sharing. I
Okay,
had to have
sure.
a crown, and I had maxed out my $1,250. So once they filed and processed my crown claim, that did pick up and help to cover some of the costs there and reduce what I had out of my own pocket. But it does pay at the 50% rate on the crown. So it's not going to be, say you got $1,250 there and it's going to take the whole $1,250. It's going to be 50% of your charges on the crown. But it helped.
Right. Yeah, exactly. And typically with the claim, so when you submit a claim, whatever you have from your calendar year maximum of the 1,000, they're gonna pull from that. So if you were short, you didn't have enough, the claim will typically get denied for that remaining portion because you don't have enough from your annual max. But usually after 7 to 10 business days, they'll refile it for you if you have any Consumer Max Multiplier Awards money, and then it'll get refiled and they'll take from that award money to offset what was missing. So as you mentioned, it does help if you have extensive or high cost service.
You have a hand raised, Maria. Dawn.
Yes.
Dawn.
Thank
Oh,
you.
I'm sorry.
No worries, no worries. It's hard to run it and see all the things. So when it's two of you, we're paying, I guess we're basically paying about 1,080. So he has already gone over his 500. So he's not going to get the max multiplier reward, right?
Yes, ma'am, that's correct. It's you earn it individually. So
Okay.
even though you both are enrolled, if he has already went over that $500 limit, it won't affect you possibly earning it as long as you stay under the 500.
That's
So
good.
yes, ma'am.
So ultimately, what they give us, we pay about $500 for this benefit, and we get about 1,000
Let's see. Are you in both enrolled separately or together?
together.
Together. So that would mean the premium right now is 9014
Right,
together.
that's it.
So
Mm-hmm.
for the year it would be 1,081.68. And then you each get 1,000 separately.
All right. Okay, so very good. So it is you get more potentially than you put in.
Well, if you do the math, it's 1,081.68 for the whole year to
Right, that's
cover
what I
both
have.
of you, and you each get 1,000. So if you want to do it as far as like, you know, technically you get 2,000, you're getting $918.32 free of if you're putting into account the premium you're putting into it.
Right. And my other, so thank you. That's what I needed to know because I wasn't sure if I was like, I think we're just getting what we put in. So that was good to finally confirm. No, we are
Okay.
getting more as an insurance. And then the other thing is it's very hard to figure out what it is for our area. The the standard cost for our area. Do you
Okay.
know a website or a link that I can go to understand what that?
Yeah, so you want to know the usual, customary, and reasonable charges for the
Yes.
provider. Okay, so are you since you're enrolled, they do provide that information as long as you have the procedure code that you're looking into finding out how much it's going to cover. So if your provider tells you you may need to have this service and this service, you can get the code from them and
Uh-huh.
then contact the dental claims department with that code, and
Right.
they'll be able to tell you, okay, based upon the provider you're going to go to in that area, they're going to cover this amount. So they'll be able to give you a more actual number figure versus
Oh,
just a
very good.
percentage. Yes. And
Okay.
if you would, do you know how to search for providers? If not, I could actually show you
I
the website
do.
where you can search.
No, I
Okay.
do know how to
Does
search for providers, so I know who they are in Durham, but the problem
okay.
is we both each have our dentist
Right.
and we prefer to go to them. But
Yeah.
hmm
Okay.
thank you. Thank you. Thank you.
Of course. Yeah. And LaVeta, would you like for me to show the website in case others aren't aware of how to search for dental or vision providers?
I think that would be very helpful and informative, and we've got time to do that.
Yeah, absolutely. Okay. And let me just look through the questions real quickly to see if anyone's been missed. I know Shanita's been responding to some of you directly. Okay. So how can I find a dentist in network? That's myuhc.com, which I'll be showing you in just a moment. And yeah, with the claim not being covered, definitely contact the dental claims department to get an explanation of benefits. And if the decision is final, you can always appeal that too and send it to United Healthcare. Right. I see Bev is asking about what the monthly fee is. We can most definitely check for you to see what you're enrolled into. We can give you a general idea, but if you want to know for sure, just to make sure that, you may not be enrolled into something you may not have realized, we can definitely check for you, but you can give our office a call at 855-627-3847, and we can confirm what exact benefit you are enrolled into, if it's just for yourself or if there's any dependents. All right, so in that case, I'm going to pull up the website and share that for you. Give me 1 second. Okay. All right. You guys can see the website?
Yes.
Okay, perfect. So the website to the dental plan, this is going to be myuhc.com. That's myuhc.com. And UHC is short for United Healthcare. If you're already enrolled into the coverage, you can, of course, if you haven't registered, of course, click the register. If you already have an account, you can always sign in. You don't have to be signed in or registered to search for providers. All you would need to do is click on Find a Dentist down here below. So I'll go ahead and do that. And it's going to take you to another screen where you're going to have to choose the type of coverage that you want to explore. Out of these options, you're just going to go with the very first one. I know it says employer and individual, and of course, majority of you guys are probably retirees, but it's going to be this option. So let's go here and explore. It's going to want to know where you want to search for plans. So we're just going to put a location. I'll put Farmville for us. You can also type in the city and state. All right. And then you're going to need to choose the type of plan. So there are 3 columns, so there's lots of options. You're going to want to choose National Options PPO 30. All right. And it is then going to take you to different types of specialists, endodontist, oral surgeon, if you have children and are looking for a pediatric. But for the most part, most of you are probably going to just go with general dentist. So let's take a look at those. All right, so we are here where you can, of course, apply filters. Your distance for me, because I use this pretty often, I've got it set to 10 miles. You can always change this if you want further or something much closer. And it's going to give you a list of providers based off that mileage from the zip code or location that you inputted in the beginning. So you can just pick any dental provider that you'd like. From here, you can automatically see their location, so the address and phone number. But if you wanted to possibly look at further details or see where they're at on the map, you can do that as well. If there is a provider that may have reviews, that will be listed here for you also. It doesn't look like this person has one, but you can get some more information on them if you'd like. You can even go to the website and locations. It's going to have those listed here for you. You can change that and you can view it on the map. So if you wanted to see where they're at. And of course, you can always go back and modify your search in case you wanted to change the location and go somewhere else. You can always update this here and enter a new location. And of course, it'll give you some new results based off of that. And if you go all the way to the bottom of your screen, you can print and download the results as well if you wanted to save a copy for yourself. And we can also send anyone who's needing a copy of these in case you don't have access to the internet. You can call the United Healthcare Dental Department to request those, and you can always contact us and we can email a copy of them or mail a copy to you as well. Does anyone have any questions on the dental provider website? Okay, so I am now going to show you the vision one. That one's a little bit more simple. You don't have to pick as many options. Okay, so the website for the vision one is going to be myuhcvision.com. So the vision one does have vision in it. The dental, you wouldn't add dental to it. It's just the myuhc.com. But you can log in using your Health Safe ID here. And the same thing applies. You don't have to be registered to search for a provider. So you can just click on this link. It will show you this message that you're leaving, that's perfectly fine. Hit OK. And all you would need to do is, if it asks you to put in a plan, just choose United Healthcare Vision plans. Oh, general dentist. I think it's still picking up the dental one. Here. Let's try that again. There. All right, so you would put the location and it's going to give you eye care locations. You can do eye care providers, so by the provider name, or you can also do online providers. There are several online websites that you can use to purchase glasses from as well, and you can use your benefits as you would by going to an actual optometrist. So if you click on all eye care locations, it's going to be pretty much the same format. You can filter it out how you would like and change the mile radius, and then just select the provider that you're interested in learning about. And you can view their location on the map. This person only has one. And then any contact information. So it looks like this provider's been in network since 2024. So of course, it gives you some useful information. And if there's any reviews, that's something to look into as well. But right, and then like online providers, if you are interested in that, it gives you their information. So you can see there's quite a few. It used to be only Warburg Parker, and over the years they've added quite a few more, so that's good. And then you can hit get started to launch their site in case you wanted to purchase your glasses with one of these providers. And you can print your results at the bottom as well. All right, and there's one other thing I would like to show you. It is the NC Retiree website. So I know we mentioned it on the presentation quite a bit. So ncretiree.com is going to be the website where it's your dedicated site for supplemental benefits. And there is a home, dental, vision, ID theft, and enroll now option at the top. On the home page, your enrollment brochure or enrollment booklet that gets mailed out is also available here, where you could view or download at any time. And if you go to dental, there is also a link to take you to the premiums for just the dental plan. So, so you don't have to scroll or skip to the brochure that much. And it has a link to the dental account, which we just looked at, myuhc.com. And on that myuhc.com or myuhc Vision, you can view and print any explanation of benefits that you may have. You could view and print your ID cards. If you wanted to nominate a provider that may not be a network, you could also do that. Of course, we looked at finding a dentist, and you can get claim information as well. So that's useful. And then Vision. You can also go to the Vision premiums directly by clicking on the Vision tab. You can launch the Vision account through this website as well. And there is a certificate of coverage for the plans on each one as well. And if there is a provider that you go to that's not in network, you can access the out-of-network claim form here also. For in-network, there's no claim form because all you need to do is give your provider your social security number or your member ID, and that gets submitted to the insurance carrier. All right, the ID theft protection has a link on here as well to launch your portal, which is where you would add all the information, the bank accounts, credit cards, your license, that information that you would want LifeLock to have to monitor and reach out to you and set up your alerts in case they find anything suspicious. and then enroll now. So if you're not enrolled currently, you would click on the enroll. You can click on enroll online or click down here where it says enroll now, number 1, enroll. If you already have coverage, you can click on this link to view your benefits. And it's going to ask you, are you already enrolled or do you need to enroll? So if you already have dental or vision or identity theft, you would want to choose the I am already enrolled, and it's going to ask you to log in. You would click continue and it'll launch it so that you can put in your username and password. So if you're logging in for the very first time, your PIN is going to be the last 4 digits of your social and your 2-digit birth year. That's like the default. Unless you have previously logged in and may have entered something differently, then of course that wouldn't apply. And you can download the enrollment form, which is going to look like this. There is one side for dental and vision, and then there is a separate application for the identity theft. If you are only needing the LifeLock coverage, you don't have to fill out the dental and vision, and vice versa. If you only needed dental and vision, you can leave the identity theft part blank. So that's the application you could view or download. This is also within the brochure. And then let's go back. You can also call our office at 855-627-3847 to enroll. So you have a couple ways of doing it. On every single page while you're on ncretiree.com, there's going to be a Let's Chat box at the bottom. This is the one I mentioned earlier. If you click on Let's Chat, it's gonna open this message. I had previously used it, so it's probably not going to show us. Yeah. But it would have Pierce Insurance, and as you can see, someone has already joined, which is someone within our office. And you would just, anything you want to ask, you can enter it in here, and it'll be answered for you during business hours. And once you're on the chat, you can email or download a transcript of this for your records too. Right. But other than that, this pretty much concludes the website. And right here, one last thing. There is a reserve your spot. Currently, we have monthly webinars for the new retirees. So each month, the next one that's going to be, it's on September 2nd. So there is a monthly webinar that we're hosting so that if you're a new retiree and kind of need some guidance on what to expect, that will help you. But on this same website, ncretiree.com, you will be able to register for those open enrollment sessions that will begin next month in September. So if you wanted to learn about that new whole life insurance product or to see if there's any changes on the dental or vision, that would be somewhere where you could definitely benefit from. And of course, the brochure will get mailed out to everyone that's currently in the retirement system. Okay, so I'm just going to stop sharing that. And let's see if there's any questions. Okay, so it looks like they've all been answered. Does anyone have any questions about the website or the benefits that they may want us to go over one last time?
I'm not seeing any hands, Maria. You did a fabulous job of explaining so much of the information that is available there. And I will say, if somebody has a claim that they're concerned about, to call United Healthcare and talk to them. I found them very helpful in trying to walk through the process of filing the claims on my crown, that because up until then all I'd done was just regular cleanings and things that were basic maintenance. So I encourage people to reach out to United Healthcare there, as well as reaching out to Maria to answer any questions that you might have about Pierce Insurance and the supplemental benefits. And always take a look and study these opportunities that are available to you as a retired member of the North Carolina State Retirement System, and take advantage of those that feel like they will benefit you and your family. I again want to thank Maria. Christina is the new president, and she was on my mind. I'm sorry.
It's okay.
And Maria has been very flexible with us today, because I originally had set this up for 10 o'clock. So I want to really say thank you for doing the flexibility there.
Of
And
course.
I also want to reach out and say thank you to Carol, who is our staff support person, who does all the background work and makes this job look very easy from my perspective. So I really appreciate Carol doing the work that she does as well. And I want to appreciate everyone who signed up and participated today, and encourage other members to join us for our Wednesday workshop sessions. Next month, we will have Roberta Hamby from the North Carolina State Health Insurance, and she's going to be talking about the upcoming changes that we'll see in our health insurance for the 2027 year as well. So that will be a very informative session as well. And that will be again on the second Wednesday of the month. And Roberta is set up right now for 10 o'clock in the morning. So hope you will be able to join us for that as well. And with that, I'll say goodbye to everyone.
Yeah.